Hello, everyone. Welcome to Doctor's Health Talk Show. I'm Farhan Tahir, joining you from Philadelphia. And today, one of my close friends, Dr. Shayma Kazmi, is joining me. Shayma is Medical Director of Thoracic Center of Advanced Oncology at the Cancer Treatment Centers of America. Shayma, welcome. How are you?
Thank you, Farhan. I'm doing very well. Good afternoon, everyone.
Thank you. So, you are one of my close friends at CTCA, but the things that we don't get to talk about today, I'll take an opportunity to go deeper into those. I would like to start with your life as a journey as a student and what led you to decide to become a physician. So, give us a little bit background of your life's journey.
So it's important for you to know that I grew up in India. I grew up in Gujarat, and I didn't arrive to the United States till I was almost 15 years old in high school. So a lot of my journey was shaped in another country. As I'm sure a lot of your interviewees may tell you, things are a little different in other countries. So I remember just always loving science and actually mathematics and love school, which made me very different from everyone else. I love going to school. I love learning. But probably the most important moment in my life is when my sister, older sister, who's 10 years older than me, decided to go to medical school in India. So, that's really hard. She was actually the first person in our entire families, both sides, who embarked on a journey into medicine. And she was a woman, right? I mean, she's a woman. So that was really cool, I thought. And then she brought home a box of human bones.
Oh,
I
wow.
remember she was probably 17, so I was around 8 years old. And I loved the box of bones. She told me to stay away from them, and I would sneak in and I would look at the femur and I would look at the clavicle and I would look at her textbooks. They were so gory and crazy with the pictures of diseases, and I was sold. I was fascinated. I was like, this is it. This is awesome. I love it.
Wow, that's pretty interesting. Um, so when you where did you go for your high school and where is your medical school?
So I did 2 years of my high school in India. So I did
Okay.
ninth and 10th grade in a high school called Little Flower High School in Gujarat.
Ah,
And it was a private school because at that time the public school in India was, sort of fraught with drugs and there was a lot of stuff going on. So my parents said, nope, you're going to this private school. Very strict school, very strict teachers. And then I literally, when I finished my 10th grade, I arrived to the United States. And that's a story in itself, but it was a rather quick decision. It was a 2-week heads up, and my dad said, we're leaving. And I arrived here, and I remember them saying, well, English isn't your first language. You can't enter into 11th grade, and you're younger than most everyone. So you would have to repeat your 10th grade. And I remember my mom walking into that school with me saying, oh no, my child's not repeating a grade. I realized she's only almost just, shy of 15. Give her any test you want. And so they gave me the English for second language test, the TOEFL test, and I
yeah.
got 100 on that because
Wow.
they said I wouldn't be eligible to sit on for the SATs. And then they said, fine, you can take the PSATs. And since I did well, they allowed me to enter 11th grade, and I was not quite even 15 yet.
Wow, that's quite an interesting story. That's so. Did you start your schooling in New Jersey? Is that
Yes,
where
I
you
did. Northern
landed?
New Jersey. Interestingly enough, I'd never left India. I went to Nepal when I was young. So that's about the only international experience I had. I'd never met an American, let alone a non-Indian person in my entire life. And I was literally thrown into a predominantly white school in Northern New Jersey. So it was culture shock to say the least. And I didn't
I
speak English. I knew English, but I didn't speak it.
Tell me a little bit about you. You had one time mentioned to me you were. Did you work on the side too when you started your school or maybe your college? Because most people growing up in other countries, they don't get to work. They just study and that is it. How How was that experience?
Well, so coming from a country where really your graduates, from higher education not having a job, I came here at 14, and my aunt and uncle who had been here forever, and my parents were struggling to get a job. They had basically minimum wage jobs here, right? And so they said, you have to work. And I said, okay. At 14, I had a job at a farm. I picked corn from the fields. I was putting together strawberries and cleaning produce, and I got $3.85 an hour, and I was amazed. I was so excited that I was worth that
You,
much money because I was still converting it into rupees, remember? Even though I wasn't in India, I was like, wow, that's a lot of money. I've been working since I was 14 years old.
yeah, most of us don't have that experience, and it shapes you. It makes you realize the value of money, time, and work ethic.
And
So
taxes.
and
It makes you realize about taxes. Like, wait, that doesn't seem fair.
so you decided to go to medicine, and you also became a pharmacist. So tell us a little bit about your journey from college and then your professional education.
So when I arrived, as I told you, 11th grade, it's sort of where all the students here embark on what are they going to do, taking the SATs, applying for college. And I was set that I wanted to go in medicine. However, it's different in the United States. You do college and then medical school. Where in India, you go right into medical school.
Yeah.
So since I had literally just arrived, my uncle, well-meaning, basically said, you know how hard it is to get into medical school? What if you do pre-med and don't get into medical school? Even kids that are born and raised here don't get in. What are you going to do then? And I said, wow, that's a good point. Well, I don't know. And he said, why don't you do something else that gives you a career, like pharmacy school? It's in medicine. This way you have a solid job, a solid profession, and you can get into it right away. And I said, oh, that sounds good. I mean, again, I literally just got off a plane. I said, sure, that sounds like a good plan. I'll be a pharmacist. So it was the best decision though, best thing I ever did. So I did 5 years of pharmacy school, became a pharmacist, and of course, my parents were like, "You're done, right?" I said, "No, I still want to go to medical school." And what was so great about it was I was able to work retail pharmacy. I worked 20 hours a week through medical school, so I was able to afford medical school and cut down my loans to half of what they would have been, right? Because my parents couldn't afford any of the stuff I was doing, all that education.
And Shema, most of us don't understand how expensive medical school is in America. Um,
Yeah.
I studied in medical school, and when I tell what my yearly cost was, let me share with you, and then you share with me your cost of medical school. So I used to pay about 3,500 rupees a year for my medical school. The cost of a dollar is about 150. So maybe $200 a year for the entire year for cost. And then I used to live with my parents. Now compare the cost of your medical school. Private schools in Pakistan are expensive, but what is the cost of medical school in the United States right now, or when
Well,
you
so I'll
graduated?
highlight you that my sister went to medical school in India and Gujarat, and it was free for her because education was free for women in India. So that was amazing, right? So the contrast that with me, when I came and I went to medical school back in 1997, and this was an in-state medical school, and the tuition was $18,000 a year, which by today's standards was probably a steal, and that did not include living expenses, right? So I had to live, pay for probably equal amount in living expenses. So say around 40 grand a year you had to put out, which my parents working minimum wage. My mom worked at Macy's and my dad worked at Burlington Coat Factory. So they couldn't afford that. And it was going to be loans. And I knew early on that loans have interest and I'm the one who's going to pay them back. So really trying to reduce that amount was important.
You became smart really quick. I mean, we uh, we usually don't have an experience about dealing with finances right at the beginning. I think, as you said, your work experience gave you that sense of looking
Hmm.
into those things, being carefully. So you decided to go to medical school, you graduated, and then I was reading your CV. You also worked as a hospitalist, and then you became an oncologist. So tell us a little bit about that life journey. Um, Anything that you remember from that life?
Yeah, so medical school, the first couple of years were not my favorite. I'll be honest. It was a lot of just, academics and books and lectures, and I didn't love it. But what I really got into third year, and I started to spend time with patients, I was again like, this is what I did this for. I remember now.
Yeah.
Which was really, really amazing. And then, it boiled down to, am I really a surgical person, or am I a medical sort of a thinker person? And I realized that I don't like masks, which is really hard during the time of COVID. Let me tell you, I can't breathe. I'm claustrophobic. I don't like standing for long periods of time. So I said, well, surgery is clearly out. So I think I'm going to go in internal medicine. And I hadn't quite decided what to do with that because I loved all of medicine. And I will say that when I spend time with cancer patients, you have to learn something about yourself when you go through this journey and you realize what you're good at and what inspires you. What I realized, one of my biggest flaws is I have no patience. I don't have much patience for things. I need sort of people to do what I need them to do, and I need them to do it right away. part of that control freak personality, I guess, of most of us. And I realized that, you have a lot of specialties in medicine, that you have a lot of non-compliance in, and a lot of sort of maybe somatic complaints. And I just couldn't do very well with that. And I really needed people to be sick for me to be able to say, I will have all the patience in the world for you, and I can handle anything when I know you're truly ill. And you really bought into your treatment plan because you're really sick and you know it. And really, I found that in cancer, because you tell a diabetic patient to get their A1C in check, and to be honest, it's a challenge. I have parents who are diabetics, and it's a struggle because it's not right in their face. Now here you have cancer, you get them to lose 10 pounds, they'll do it. You get them to gain 10 pounds, they will do anything, because cancer has that, maybe just the societal cultural impact of fear of a life-threatening illness, even if it's chronic. And I really get a lot of people who do exactly what they need to do, which is super gratifying.
Wow, that's very interesting. I would have never thought that way. That could be another way of looking at the field, is to how compliant your patients are gonna be. And now, being in the field, um, are you realizing the power that you've been bestowed upon you from your knowledge, and how are you helping people, and what is your day-to-day life as an oncologist?
Well, I am
Especially lung
super.
cancer, right? Lung
Yeah.
cancer, you are a thoracic
Mhm.
oncologist, and the director for that. So what kind of patients do you usually see, and what is your day like?
So, of course, I do lung, I do thyroid and breast as well. So I get a really nice mix of patient population, very different. Of course, your female patients are going to be different in personality, behavior, compliance than your male patients. That's not sexist. It just sort of is what it is. And I love the mix of the two of them. For most men, I have to draw them out. They don't want to volunteer complaints, and with women, I have to sort of get to the point sometimes. So it's really an honor. I mean, I love every day that I spend with patients. Other parts of medicine we can talk all day about that are less than desirable, but when I really am in the room with a patient, that's when I'm really living what I was meant to do. I'm trying to figure out what bothers them most, trying to figure out where my biases are, what I want for the patient, and really what they want for themselves. And sometimes they're two different things, is the challenge I think that most of us have. So that's really great.
Now, tell us a little bit about new drugs. You've been involved in immuno-oncology. You teach. You have over maybe every year we've been talking about it. You have like up to 40, 50 lectures across the country. You travel. You teach other
I did
doctors.
82 last year.
82. Wow. So what is on the horizon for non-oncologists to know about immuno-oncology, and how is it changing for types of cancers you treat?
Huge. I mean, really, a decade ago when I trained, more than a decade ago, lung cancer was pretty terminal. I mean, the median life expectancy in metastatic lung cancer was less than a year. No matter what you did, no matter which chemo you gave, it was just sort of what it was. And now I have patients who I was trying to send to hospice 4 years ago who are annoyed about having to come in every 3 months for scans, who are not on treatment. I mean, and quite a few of them. This is not a one-off, two-off. This is really, there are patients who respond to these novel therapies that live a full life where they don't feel they are sick. They may need treatment off and on, but the treatment isn't toxic often, and they can handle it very well. And it's amazing. I mean, we stop short of using the word cure because that's just a very, retrospective word. You're not cured until you die of something else, right? So
Yeah.
it's a tough word to use in medicine, period. But it's amazing. And really the changes that are happening are daily, and their drugs approved daily. So I think the huge challenge, it's not just for non-oncologists, it's for oncologists who are in the community setting, who treat many types of cancers. It's hard to keep up, and it's hard to really make sure you're not really missing an opportunity for a patient with a treatment that you may just not have heard about. So that's really where I'm passionate about, making sure everyone is aware of what's happening, what's the new standard, and really spreading it out to some less city-like parts of the country, some more rural areas where most of the Americans would go for treatment.
So now you have also been involved in teaching. Medical school students come and work with you, so you have now another aspect of your profession. How is that experience going so far?
So I think my nurses are happy that I'm not harassing them anymore
Yeah.
because I love to teach, and I often use my morning meetings. I don't know if you've attended them, to kind of talk about new drugs and new treatments and physical exams and things. And I think I often get the roll of the eyes from some of my veteran nurses. But it's really been great. I've missed it. I have to be honest. I didn't realize that I missed it. The basics of medicine, especially in a time when I think that medicine is being sort of really boiled down to a transactional interaction, I think, by a lot of companies, by a lot of hospitals. I think to revive in them the sense of why they're doing this and why it's important to talk to a patient, and the physical exam, and really being able to, make them excited about medicine, no matter what kind of medicine they're doing, is fun. It's really fun.
So do they ever ask you a question, are you happy with being a physician, or what is the reason they should, how can they be happy in this profession? What do you tell them? What to look out for? Like sometimes people are like, I'll be making a lot of money. I'll be, important person. What do you tell them? What brings happiness to a physician?
That's such a big question. I think what brings happiness to an individual is not looking outward for validation and worth. I think that's the lesson in the past 20 years. If I've learned nothing else, is that your employer doesn't define your worth. Your spouse, your parents, nobody else validates you for who you are. Really, it's looking inside and deciding what you're worth and who you are is where the happiness is truly going to come from. And no amount of money will buy you that if you don't have it coming from inside, right? How often do you hear physicians and employees really saying, I don't feel valued. Nobody appreciates what I do, right? And that's a pervasive thing all around. If you're looking for someone to validate and approve and congratulate you in your life every step of the way, then I think that's going to be a challenge. You really have to find that inside to be able to say, I'm worth this. They're not willing to give me that. And then I can do other things. It's not personal. it really is something you have to realize that it comes from inside.
So that takes us to another question of I've known you to lead a forum of physicians in our hospital at CTCA, where you have brought on experts in personal development and help doctors understand how they grow themselves, how they feel happy about their own um, selves, and tell us a little bit about that. Why did you need to do that, and where you're heading with that? Because we have not seen or heard that in medicine ever in our trainings. So tell us a little bit about that.
So I think I hit a wall in my journey as a physician. So prior to really coming to this point, there was a time where just the onslaught of the things that it was required of me and the pressures put on me with the organization and the things that we were expected to work in, I was burnt out. But there was not a term for it at the time, you know. So burnt out me was angry, frustrated, just agitated by the way things were being done. And of course, you know, I get labeled as a difficult person, which often is one of the things that happens when a female is angry about the way things are. And that's a whole separate topic. But I felt myself just angry and not happy. And it I met Jay, the coach that you have met as well. And in my journey on really just the personal coaching endeavor, we realized that what I was going through is not unique to me, based on his experiences. And what we realized is that really this is pervasive through medicine because of what we are enduring now. And I said, well, not everyone can have a personal coach. So we need to do something within our institution that really engages and really is an investment in the professional and personal development of physicians. Because at the end of the day, if I'm having a bad day, a bad week, a bad month, it pervades through my entire team and my patient interaction and really everything around me. And it becomes a culture problem, right? And so it's from the top down. So I think really investing in physician well-being, both personal and professional, was really important. And it's been an amazing journey. We've had the forum now for 2.5 years with 8 members, and I could tell you that we've all grown substantially from it.
Each one of members who I've met and talked about it, I've seen the change in them over the year in my personal interactions with them. I won't name people, but I've seen people, I used to see them frustrated at work. And it's not you only, but there were other members in that group that were frustrated. And now I see them be able to handle problems in a much different um, approach, and their demeanor is changed. And I think what I see, what you have brought in is that, you know, previously people used to say, well, I'm done with this place, I'm moving on to a new job. But we never look into how we can change ourselves to our surroundings and make things better around us. And I think that's what has helped you, because most physicians would change the job, but 4 or 5 years later you go into the same circle.
Right. Correct. It would be the
So,
change you want to see outside, and it starts really from the inside.
all right. So tell us a little bit about what are the what are the roadblocks of a physician who is so um, ambitious and driven as a personality as you are. What do you find as your roadblocks that frustrate you on a day-to-day basis?
24 hours in a day. You know, I really wish the day was longer. No, honestly, I think that it's all in perspective, right? So really the balance is I want to be a great spouse. I want to be a great child. I want to be a great mother. I want to be a great physician. I want to be a great mentor. I want to be a great teacher. I want to be a great entrepreneur. But there's only so much time in the day. So at any given point in time, I have to constantly prioritize the opportunities that come my way, I have to learn to say no when I know that it's going to come at an expense that I'm not willing to pay, whether that's an expense of my personal time and really also downtime, right? So I think that's part of what makes me sane and be able to do the things I do. So it's really sort of juggling all of that on a daily basis.
So currently you have, there's no job is perfect, but you have made it work for you in the best, best of both worlds. Where do you see yourself 5 years from now? You're already well-spoken um, public speaker in the field of medicine. You've contributed a lot to research. Where do you feel yourself going forward for 5 years from now? Are you satisfied with the journey you are on and you want to continue along?
I am satisfied so far, but what I will say is that in the next 5 years, I'd like to branch out more from the perspective of physician coaching, just dealing with the epidemic of physician burnout. I mean, we have hordes and hordes of physicians leaving medicine. When I'm old and I need a doctor, there's not going to be any. And it's an epidemic. I mean, physicians commit suicide at the rate of one a day, about 350 suicides a year, right? So I would want to spend a little bit more time in making sure that a very, very important part of our population, the physicians, are taken care of. And how do we take medicine back into our hands if at all possible? So somehow I want to be able to contribute to that. I love clinical medicine, so I think I definitely see myself still doing that. Maybe not full-time, maybe part-time, and maybe balance life out that way.
So what you just said, I was not aware of that. Be honest with you, that a physician dies every day, and I did not
Suicide,
know
yep.
that suicide and that physicians are leaving the profession. That's a surprise to me. So what are the major reasons? Is it just frustration of administration versus workload? What is it the main cause behind this problem?
So it's a combination. Again, I'm going to give a physician burnout lecture at the ASCO highlights, and the one that's in Philadelphia if you want to join. But
Okay.
it boils down to, I think, lack of control. We are people that have gone into medicine because we're type A personalities. We like to be in charge and control of patient care and what we do, and more of that has been taken away from insurance companies. Let's start with that, and just battling for things that we know the patients need to have and deserve, battling the administration for employment and fairness, and being able to be compensated fairly, hours, debt, and really just that balance is missing, really, and that appreciation that we all look for outwardly is missing, and really that satisfaction is gone. So a lot of physicians, I know personally, physicians have left medicine because they gave up on that fight, and they're fantastic physicians. So I wish that we don't lose too many more of those. And I think talking about it and giving term and a meaning to that word and that feeling is a big part of starting to deal with it. It's very much like mental illness. It's like a taboo topic. You're a physician, you're well accomplished, you have money, why are you complaining, right? That attitude is what's gotten us here.
Wow. Okay. So question for you is, having being part of that forum, has that helped you? And you think that more doctors should actually seek that path, and it would give them like a sort of a reflection on what's happening and how we can approach this problem?
Absolutely. I think that really investing in your personal and professional growth, something we don't do. I mean, most of us spend so much time giving to patients, giving to administrators, giving to your families, that we don't really ever have time to reflect and say, what is it that I need? What is it that I want? And what is it that makes me fulfilled in my journey? And if we had that time for self-reflection, and then that's important, and then prioritizing our life and designing our life, we have the luxury and the ability to do so. We're generally pretty smart people, right? And generally people who have the means to do this. So we really need to be able to engage more people into that path.
So Shayma, you mentioned something about um, don't look outside for recognition, or look within your own self. So w- to extend that, I would like you to ask you, share with us what you know now you wish you knew like 15, 20 years ago, and how would you change that if you knew that? What is it that we need to understand about ourselves? How can we study ourselves?
But I think that's absolutely one of the biggest life lessons that I've gotten from the forum. This whole idea, I remember having a conversation with Jay about, I just don't feel appreciated, and just don't look at all the work I've done for some this, and I don't feel like I get the thanks. And he replied to me and said, wow, oh, so the CEO of the company is supposed to thank you. Do they know that that's their job to validate you? And it was like a light bulb that just went on. I said, duh, of course not. Maybe they have no idea, nor do they realize that that's day to day. It would be nice if they did, but that really isn't part of the administrator's job, is to validate and thank and honor people who are doing their job, remember? And I think that was really a pivotal moment. And if I had known that in the last 15 to 20 years, that everything I'm doing, I need to be doing for me.
For your personal
Because
growth? Yeah.
and if you really want someone to know that value, of course, when you're doing contract negotiations, make sure that someone knows what you're doing, right? Because they may not know. Really make sure you highlight it. So to be able to speak about what you've done and your accomplishments, it's almost taboo in medicine. It's something you're supposed to just do, and you're not supposed to ask for compensation for your time. And these are just sort of these things that we have just learned to do, and I don't believe that they're true. I think you really need to identify your accomplishments, and you need to lay them out when you're looking to get something that you want, whether it's compensation or a certain position. I think we haven't taught our students how to negotiate. We certainly haven't taught us to be kind to ourselves. We really haven't. It's almost old school. I did the 36-hour call. Well, I did a 48-hour call. So whatever, don't whine about it. That's just our culture, and I think it needs to change.
Oh, that's very profound. And I think we'll have to bring Jay on board one day, and both of you talk to us a little bit more in detail and give us some more tips. My question for you is, everyone, has a soft part of their heart for some group of society that are they need our help. Like for me, it's underprivileged poor kids in Pakistan who don't get education. Is there a part of the world that you actually feel like we can't really have all the resources to help them, but you want them helped more often? Is there anything, any person that you know or any group that you want to talk about?
Well, so I don't know of personal charities, but I know that there are a lot of grassroots organizations. These are not big charities that do help education in India, Pakistan, and some parts of Africa that even my local friends in our community have started. And whether it's as big as far away, hungry children, or really as simple as just our local community. So what we do a lot with is children in our local community, and I mean we don't have to go far to see hungry children who don't have technology, who don't have the ability to have access to books. Camden, Trenton. So we do a lot of local stuff with a couple of my friends who are on board of a community South Jersey organization. My neighbors do this. So I think that there is the global, of course, UNICEF, and those are the bigger organizations, Physicians Without Borders, that I really love and cherish. But there's the local, it starts from here, just from local footprint, help your neighbor, help the town, help just a town over from you that needs help, and it doesn't have to be too grand to help.
I remember one time talking to you, and you said um, people always go and look for the group they belong to go and help, but really it is people right around you. They may not be the same religion, may not be the same ethnic background, but there might be help right there. And as you just said, the area where we are, Camden and the region, there are many places where we could give easily help to them, and they would appreciate it. So that's a very nice lesson. I would say, Shema, that one piece of advice I want to conclude this professional talk is, because I see that you are a very confident public speaker, and that is a hindrance in a lot of people. I mean, most people are very afraid of public speaking. So how did you overcome your fear of public speaking, and what is your advice for people who want to be public speakers?
Well, let me tell you, I was super shy and I hated public speaking. To some degree, I still get anxious. So what I knew was that I wasn't good at it. I still have palpitations and sweat rolls down your back, but you have to do it. I mean, you have to face your fears, right? It was something that I needed to overcome. And it was literally practice. There were times when I was terrible. I mean, I had some interviews on Fox News or something. I was stumbling. I was just babbling and I was completely mincing up my words and they were embarrassing. They were terrible. But instead of, I didn't say I'm going to stop because I'm terrible at this. I said, I'm going to keep going, until they stop inviting me. And it's practice. I mean, I think none of us are born speakers or,
Wonderful.
but even talking to patients, that is good practice as well.
I would tell you that I've seen you in almost every marketing campaign that happens in CTCA is to see you, because you are one of the confident people in our hospital, and it's good to know that you actually were not born with this. You worked on, practiced on that skill. So thank you for sharing that. Okay, well, I have to say that this professional session was very informative, and I would conclude that with this question. And we will come back again for the fun part, where we would like to explore your lighter side of your life. Thank you so much, Shema.
Thanks, Farhan.